Welcome to our video about Candida auris, an emerging fungus that has been spreading across the US at an alarming rate and has been linked to severe and potentially life-threatening infections in hospitalized patients. First identified in Asia in 2009, Candida auris is a yeast responsible for many infections and is resistant to most antifungal drugs. Since its initial detection in New York City and Chicago, the infection has spread to more than half of all US states and become endemic in some regions. Reports show that transmission of the fungus has grown in the Mid-Atlantic, Midwest Texas, and Florida areas, and that infections have climbed over 200% in the past 2 years, with over 1,400 recorded in 2021. Weak immune systems, diabetes, prolonged antibiotic use, and the presence of tubes and catheters in hospitalized patients lead to higher susceptibility of complications with Candida auris. Symptoms can vary, but include fever and chills. Mortality rates in fungus outbreaks have been as high as 30%, particularly in long-term care hospitals with severely ill patients. The fungus is often found to be resistant to standard fungal infection treatments like azoles, amphotericin B, and the main drug class of echinocandins. Resistance to echinocandins occurred in 1% of samples tested in 2020, with that figure tripling in 2021. This is concerning because echinocandins are the first-line therapy to treat the infection. The CDC attributes the rapid spread of Candida auris to weakened infection control during the coronavirus pandemic, resulting from an overburdened healthcare system, staff shortages, and increased use of antibiotics. The CDC emphasizes the need for surveillance, diagnostic testing, and adherence to infection prevention and control protocols. If you or a loved one has been hospitalized and are worried about Candida auris, speak to your medical provider and ensure that infection prevention and control protocols are being followed. Knowing the symptoms, seeking medical advice when needed, and taking the necessary infection control procedures can help prevent the spread of this potentially lethal fungus. For more on the startling rise of infectious diseases like Candida auris and how we can keep ourselves safe, join CNBC's virtual event, Healthy Returns March 29th. Learn more and register at http://bit.ly/3dunbro. Thank you for watching and stay safe.